This is the February 12th, 2024 Board of Health meeting for the city of Pere. We start out with a call to order. Roll call, I guess. Pamela Gantz, alderperson.
Here.
Devin Peacock, I'm sorry.
Yep, that's close.
Okay, here. Terry Gulas.
Here.
Dr. Michael McHenry.
Here.
And Dennis Highbray, here. As for city staff, we have our new health officer, Crystal Wohler. Crystal was with us 7 years ago as health officer for City of Pere and decided to come back. She's having so much fun now, isn't she?
Yep,
Yeah,
right.
And we have Kelly Burke here as well, Kelly.
Here.
Administrative assistant. So I believe that we do not have a medical advisor online at this time. Dr. Cassie Chandel. Nope, not yet. She's a new medical advisor, and we have yet to meet her yet. So she was just recently appointed to that position.
Okay.
Okay. With that, any public comments from the public? There are no members of the public here, so I guess we will just go through that then, since there's nobody here for that. Approval of the November 13th, 2023 Board of Health meeting minutes. Can we have a motion for that?
I'll make a motion to approve.
And a second?
I'll second.
Okay, discussion? Okay. Hearing none, I'd like to thank Terry very much for chairing last November's meeting. I was out of town, and so thank you very much for taking care of that. Hope you had a good time doing that as well.
It's fine.
Okay.
You've instructed me well.
Okay.
You did
So-
great.
Hearing no discussion, all in favor, can I have a motion to approve the meeting minutes?
We did that?
Okay, can I have a
I'll
second?
second.
Okay, any, all in favor, say aye.
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 Any opposed, nay? Motion passes. Next on the agenda is the Pere Department Staffing Update, and that relates to our new health officer. Crystal, several of us were involved in the interview process with you, and we were very impressed with your qualifications, and the rest of us were, you started January 5th, I believe.
Yes, January 5th.
And can you tell us a little bit about yourself?
Sure. So as Dennis mentioned, I worked for the city of De Pere before, and it's been about over 7 years actually that I have been with St. Norbert College, came back to the city of De Pere. So before I worked with the city of De Pere, my first tenure, I worked at Brown County Health Department as the nurse manager. And even before that, I worked in public health out of state in Iowa. And before that, I was way up in Oneida County, Rhinelander, Wisconsin, in public health. So I've had a little taste of rural public health. I've had, municipal public health. I've had out-of-state public health. So, it's always been a part of me. Even while working at St. Norbert, I was able to navigate the COVID pandemic doing public health. So I worked really closely with Debbie during, that time, not only during COVID, but even before COVID. And so it's been a great working relationship with Debbie. She did such a great job, and I'm so glad to be back. Thank you.
Yeah, welcome.
Thank you.
Well, welcome, Crystal.
Just
We're
curious
glad-
about how,
Yes, go ahead.
how public health is in the setting of college,
Yes.
college campus. It must be quite different than, it is a community, but it's,
For sure.
yeah.
Right. So organizational public health, it definitely is different. Like you said, St. Norbert College has a community within itself. It has its own post office. It has, law enforcement. They're not sworn officers. So they have many of the components as a city. It's just very micro level, right? And the population, too, isn't as diverse. We have mostly young adults, 18. Sometimes we'll get a 17-year-old, but 18 to 21, 22-ish. And so healthy young adults for the most part. But you can still inform health policy on a college campus. During my time there, I worked with other campus partners to have the college campus go tobacco-free. And so you can still do public health policy on an organizational level, and it really, your population drives your policy and your public health actions. So it's a little different. It's more micro, level, but you can really see how public health policy at a jurisdictional level impacts an organization. And I think that's what I learned most when I look at public health policy and how it impacts an organization. That was most impactful for me, seeing that difference. So it's been a good run. So
Did you grow up in Wisconsin?
I did. I'm from Wausau, and then went to UW-Oshkosh, got my bachelor's degree in nursing, and I started up in OB in Rhinelander, Wisconsin. So was an OB nurse, and then figured I can't really do the third shift too long, and found public health in a local ad and didn't really know what it was until I got into the role. So never looked back. Have always stayed in public health when I made the switch. So yep, I'm from Wisconsin.
Did you
Just
get your
one more
master's
question.
from Oshkosh as well?
No, from St. Norbert College. So I have a master's of business administration.
That's what I was going to ask,
Yeah.
how the MBA impacts your abilities, I guess, and your approach to public health.
Right. Well, it definitely has helped. I think that especially during, COVID and supply chain issues that we were having and understanding the logistics of that, even budgetary things, all of that really helps any administrative role in healthcare, in public health. So I have found it very beneficial.
Yeah.
And the Schneider School of Business is pretty top notch. So
Any other questions for Crystal? Crystal, we on the board welcome you as health officer.
Thank you.
For City of De Pere. Thank you very much for accepting the position.
And in the memo, I just wanted to add one more
Yes.
thing, if it's okay. So Sarah Lawrenson did take on the deputy health officer role, and so I wasn't sure if that was talked about at previous meetings. I just wanted to be sure that you knew that she was taking on that new role. So Sarah is now the deputy health officer. That happened in December of 23, and then in December of 23, Debbie also discontinued the LTE staff. So I wanted to be sure that you all were aware of that as well.
Okay.
Thank you.
And then Debbie Armbruster, if you are watching, want to thank you again
Yes.
for your 7 years of service as health officer.
Yes.
And you may be watching, you may not be, who knows, I guess. But enjoy retirement. That's all we can say.
Right. Agreed.
Thank you, Crystal, for your background information and again for becoming a health officer.
Thank you.
Next on the agenda is results of the Wisconsin Administrative Code Chapter Department of Health Services 140 review from November 7th of 2023. And for that, we have the Regional Director for the Division of Health out of the Northeast Regional Office, Chris Collada. So Chris, if you'd like to say what you want to say about it.
Yes, please. Thank you. Good evening, everyone. I'm Chris Collada. I'm with the Wisconsin Department of Health Services Division of Public Health. I'm the Northeast Region Director. We define Northeast Region as a 17-county area with 19 local health departments and 3 tribes. Why am I here tonight? So we have an administrative rule, DHS 140, and it says we have 85 health departments in the state of Wisconsin. On a 5-year rotating basis, we have to come out and do a minimum compliance audit or check-in and make sure the health department is meeting the minimums in statute and rule. This is not a got you audit. This is the time we show up. It's more about quality improvement. It's more about questions. So we're here on November 7th of 2023. The City of De Pere is a level 2 health department. There's 3 levels of health department in the state of statute. Basically, we asked a number of different types of questions, and Crystal's like, oh, I wasn't here for any of that, but it was fine. It went very well. And so just some highlights from the review. Dennis was there as your chair, your mayor was there, your administrator was there, just very, well, you technically had a deputy administrator that oversaw the health department in December and November, but not now. It's switched back to the administrator, and she also attended. So one of the strengths or the highlights of the city of De Pere, and I've known this in my role, I've worked in state government for 25 years. I've worked for Department of Health Services for 10 years. And I've been coming to 140 reviews. I've worked with Crystal back in 2014, 2015, and 2016. So welcome back to your role and look forward to working with you. One of the strengths of the city is your support from your leadership. We see strong support from the Board of Health. We've seen support from the mayor. We've seen the support of your city administrator. Just having the conversation about considering and adding a deputy health officer. We've seen in COVID the stress and strain put on smaller departments that only have one manager or one health officer or director. And it wasn't sustainable. We've lost probably 60% or greater of health officers in the state in about over a 3-year period. And so by adding that deputy, it's a way to build succession planning. It's a way that Crystal, as your health officer, can take a vacation and know that somebody's there. And so that's really strong leadership. And the other thing we see is the city departments. The city of De Pere is different in some ways. Like there's just such cross collaboration between like police and fire and public health and other agencies. There's just a can do, we can work together attitude. And I'm not just saying this because you're alders. I'm saying this because it's truly what I see. I get to see a lot of different governments, and that's something that makes De Pere special. And I think that starts with your leadership. The second thing is the messaging modalities. So the review team, I am locally based, I'm out of Green Bay, and I had some staff here, but then I used to supervise the 140 program. I gave that up in April to focus on some workforce development type things because workforce is pretty busy with all the turnover and different things of capacity. And the team that came from Milwaukee drove downtown, and so message modality, you have your big public health, radon aware, I mean, that kind of like, wow. The health department has done an amazing job doing social media, newspapers, local newspaper, postal mail flyers in the community, movie theater ads, banners hanging across the street, televising Board of Health meetings like this right now, and just being at the community events. You guys have your mobile unit that Crystal says she won't drive, but that's okay. Those are things going out in the community with other departments. So those are huge strengths that we wanted to highlight for the city of De Pere. Now there is only one, but there is one quality improvement opportunity. So the review team noted that the health department stated staff competency assessments are conducted every 3 years. And so in DHS 140, it says that staff core public health competency should be completed at least every 2 years. So our recommendation, and once again, this is a recommendation, is that the City of De Pere Health Department go from 3 years to 2 years on doing that staff competency. And we have that for a couple reasons. We have that, number one, there's been a lot of turnover in staff. And we're seeing that. I know De Pere and many other agencies recently participated in a costing and capacity survey, and we're starting to look at that data. It should be public in the future for all the agencies to see that data, but we're seeing a lot of responses that people are thinking about leaving, or people are like, Debbie retired and they left public health. And so there's a lot of competition for workforce. And that's one of the challenges. Pay can be a challenge, stress of COVID, or just hearing from a public that doesn't always like what public health is doing and sharing their displeasure. There's a lot of pressures. And so that's why having that competency done more often is because there's probably going to be turnover of staff more often. So those are really the only recommendations that we had. So 2 strengths and 1 quality improvement opportunity. Is there any questions on that? Otherwise, I have one other side part I want to just dive into before I read a certificate. So any questions on the review? Or Dennis, anything you want to add? We really appreciated your leadership in attending.
I think it's very important for De Pere to, I mean, we're one of 3 health departments in the Northeast region, besides Appleton and City of Menasha, that we have city health departments established, and they all provide very good services to the citizens of their communities. So I think we're very fortunate to have and maintain a city health department in the city of De Pere as well. So I can't remember, I think it was about 119 health departments back when I started public health in 19, gosh, too long ago, 78, somewhere like that, and or 1982. So it has changed a lot, and COVID has changed a lot as health officers and put them either in retirement or different change of jobs. It's been a rough 3 years plus for public health in Wisconsin. So we're glad that we had a good health department in De Pere to curtail or to help with the COVID outbreak that we did have, not only in Brown County, but in De Pere as well. And as well as many other issues that we have public health-wise in the city of De Pere. And we look forward to working with our new health officer as it relates to the future. So we're very pleased about that as well, Crystal. So we look forward to that. So with that in mind, how do you feel about the only issue that was raised by the state of Wisconsin as it relates to competency assessments?
Yeah, definitely noted. I think to your point, Chris, that is very valid. Making sure that, that competency assessment happens every 2 years is easily doable. And so we can make that change and update our records accordingly. So thank you.
And just expect, so we've added a quality improvement to our process, and that is we reach out somewhere about 3 to 6 months after the review, and we ask the question, did any of the advice the state provided matter? Is there anything that changed? And we're seeing huge successes. And the funny thing is, no agency has the same issue. Everybody has different, some are more tourist-based populations, some are more urban, rural, suburban, whatever. And so it's just a way to document that the 140 process is making a difference. And so it's really behind the scenes, but once again, it's just a suggestion, but it's probably a pretty solid suggestion.
Yeah, makes sense.
And Chris, this review is every 5 years?
It's every 5 years,
Every
correct?
5 years as well, so.
There's some cases we move it up if the health officer changes or if somebody wanted to do a level change. We just had, I'll be going to Manitowoc County. They were a level 2 health department. They have a new health officer that meets qualifications, and it was the desire of the county to go to a level 3. So we had to go through a review, ask additional questions for level 3, and then they leveled up. But otherwise, it's 5 years.
Does anybody on the board have questions of Chris as it relates to information we received about our health department and the review? Yes,
What is the difference between the different levels?
Okay, good question. I wasn't going to go there on purpose, but I can't go
Yeah,
there.
I know.
So
You don't have
there's 3 levels of health department, and it's spelled out in state statute. And so it basically talks about level 1 is, there's only a couple of them. They typically, it's the lowest level. It's not that one level's better than another. It's basically they have a public health nurse. They don't have a whole lot of capacity. We have no level 1 health departments in the northeast part of the state. A level 2 is what you are currently. And so there's certain requirements. So there's certain health officer qualifications. And for some candidates, it's actually harder to hire a level 2 health officer than a level 3. So Crystal's got a background as a public health nurse. She's done a lot of communicable disease. So the statute talks about, it doesn't define how much communicable disease, but it says you must have communicable disease program experience. Well, what does that look like? That's a workforce thing that we're trying to work on some answers for that and maybe come up with some academic courses. And then it's either you have to have 3 years of experience, and so she meets those qualifications. For a level 3, and there's a big change. We did an update of Administrative Rule 140 3 or 4 years ago. I'm losing track. In the past, we said a level 2 had 7 programs and a level 3 had 14 programs. Turns out that was an arbitrary number somebody made up sometime in the past, and that's probably not a good idea to base an administrative rule on. So that was changed, and now it's more a qualification. So a level 3 health officer, you would see they would have a master's degree or a minimum of 16 credits and 5 years of public health experience. And so in statute, there's a list of, so like I have a master's of public administration. That's spelled out as one of the acceptable degrees. The challenges we're seeing as education gets more and more advanced, we're seeing more and more degrees. Well, is this? And so how far do you push what's in statute? And so that leads into reviews of transcripts and other things. And once again, we're working on something from an administrative rule change to maybe up that. So that's the difference. One's got the more communicable disease supervisory, and one's got more of the master's degree, or the 16 credits towards a master's.
Thank you.
Dennis, do we need an action of the board for changing that, the frequency of assessment of the staff?
I don't believe we do. I think it's part of the statute, it's part of the administrative rules as it is, so it's something that is required.
Okay.
So
So it's just operational.
just operational, yes, thank you.
Okay.
And then I did just have, before I read the certificate, our state health improvement plan was recently updated, and they just sent out some talking points this week. So not reading all of them, I'm not doing that, but I just wanted to share. So the Wisconsin State Health Improvement Plan is a roadmap to population and community health improvement in Wisconsin. It's a guide for the public health system and provides a platform for strategic connections and alignment with local partners, plans, and initiatives. It's a lot of work that's already happening. I mean, the De Pere Health Department is doing a lot of that type of work already. Objectives, strategies, sample activities will help to guide improvement partnerships, coalitions, and activities. And then just a few other things. This implementation guide is intended to be flexible enough to be adapted to meet the unique needs of the community that wishes to utilize it. That being said, we have 85 health departments. We're a home rule state. And so the state isn't coming in and saying you have to do, there's some cases the state does come in and say that for certain parts of government. But as far as this is a guide, this is suggestions. I think it could be useful if you can align with the state health improvement plan, because if you're writing for a grant and you say, oh, we're aligning with Healthy People 2030, we're aligning with the state health improvement plan, I think it gives us strength, but it's not something that you're mandated to follow. So that's as far as I wanted to go. I just wanted to introduce that came out, and that's another resource, and Crystal can always share that in the future with the board.
I thank you very much, Chris. Any other questions of Chris from the board?
So then I have a certificate of designation from the Wisconsin Department of Health Services to the De Pere Health Department is a local health department in good standing with the statute set forth by the Wisconsin legislature and relevant administrative rules of the department. This local health department was formally reviewed by the Wisconsin Department of Health Services, Division of Public Health, on Tuesday, November 7th, 2023. It has been determined that this local health department meets the requirements and is so designated as a level 2 in accordance with DHS 14008. This designation is in force up to 5 years. This was signed 12/20/23 by Paula Tran, who's the state health officer and the administrator of the Division of Public Health. When I ran this program, it was so important that we got it in the same year, because otherwise it would get really weird if we reviewed 1 year and then we weren't following statute for that 5 years. So this is a certificate. I can leave.
If you'd like to bring it up here, Chris, that would be great
I
then.
can bring it up there. I'll even give you the box because I don't want it.
Thank you for coming, Chris. Oh,
Even though you were
the
here.
staff did a great job. The
Yes.
staff and
Thank
Debbie.
you very much, Chris. We'll just pass this around as well. In fact, for the cameras, you can see what it looks like.
Nice.
Otherwise, I thank you for the opportunity to come. The De Pere Health Department is doing fantastic work. We look forward to Crystal's leadership. I know you have a great relationship with Brown County Public Health, and so I'm excited to see where the Beyond Health Steering Committee and all the different efforts for the community health assessment and different efforts going on continue.
Thank you.
Thanks, Chris, for coming tonight.
Thank you.
Thank you.
Have a good evening.
Should also point out, and I neglected to say this, it's very nice to have a deputy health officer as well with Sarah. It was a decision that was made by the administration here, and I think it was a good decision to have Sarah in that position to carry over when Sarah is gone and vacation and everything else like that. So, Sarah, we're glad you're in that position as well and was recognized as that position.
Yes.
So, any questions about this? You've got big shoes to follow now.
Yes,
Crystal,
right.
don't you?
Right.
I can hear Debbie chuckling over the TV set already. Okay.
Good work, Debbie.
Yeah. Okay, Crystal, next item is discussion of the 2024 grants for the health department.
Right. So speaking of Debbie, she put this very nice document together for me. I just wanted to point out and highlight that all of the 1, 2, 3, 4, 5, the first, well, 4 are really a standard consolidated contract. It's what we get every single year from the state of Wisconsin, pass-through money. And so I wanted to highlight, especially the immunization grant. We did see an increase of $840, but otherwise it's pretty status quo. That Coverdale Stroke Program actually is a contract with the fire department. The fire department leads that, and we collaborate with them to do home visitation. So we do receive a stipend for our time to do that program. But the fire department takes the lead on that. Otherwise, prevention is the same. Preparedness is the same. Public health infrastructure, now that's new. We haven't started tapping into that money yet. That does go until November 30th of 2027. But because we have ARPA money, and you'll see that below under the COVID-19 grants, we would like to use that money up first. But I just wanted to show you all, as of, January of 24, this is what our grants look like. And I would say this is the biggest learning curve for me coming back to public health is all of the grants that are made available, which I am so appreciative for, because for so long public health has been underfunded, and our infrastructure has been weaker than it could be. And I think with this infusion of funds, it helps local public health, not only municipal health departments, but county health departments, really strengthen their infrastructure. So very appreciative, but it's a learning curve. It's a lot to manage. So, and Kelly, thanks to Kelly, she has done an amazing job with that too. So any questions?
One question on the Coverdale stroke program. It looks like it's ending very soon.
Yes.
So that's it?
It's a renewal, actually. So we did check with the fire department, and they did renew this contract. So we will continue that service. It wasn't noted here. Good observation. So that will continue. And so that's a nurse visit. We go out after discharge from the hospital. If the resident accepts that home visit, we'll go out and talk to them about risk factors and connecting them, to resources in the community. So it's a really great program, and it really is intended to decrease readmission to the hospitals.
Crystal, I have a question. I guess the COVID grants, they also ended December 1st of 2023. Is that correct?
Right.
Okay.
Well, that was the amount that we had as of December 1st, 2023. Now, the immunization and vaccine for children under COVID, we just submitted an extension request.
Okay.
So that one is to end June 30th of 2024. And literally, we still have about $24,000 in that account. And so they've just broadened the scope of that. So we can use it for other vaccines as well, not just COVID vaccines. So that will be helpful to allow us to buy supplies for vaccine clinics and things like that. So that I did ask for an extension. It would extend, if approved, to June 30th of 2025.
Okay.
Yes.
And I'm sorry, I made a mistake on that. That's actually what the amount we have left as of
Correct.
that amount.
That's correct.
The ARPA grant actually goes on to 2024, December 31st.
Correct.
Do we still have staff on board for that now?
No, the LTE staff were discontinued.
Okay.
So we are looking to explore how we can spend these funds in the time period, but also working with our community partners to do so. So we're looking internally and externally to see, under the stipulations of the grant, how we can spend that down by the end of the year.
Can I ask what the stipulations are?
Well, they're vast, and I'm
Okay.
still learning them.
Okay.
But overall, it is recovery from COVID. So, of course, anything over 5,000, we have to get pre-approved from them because it's considered a capital expenditure. But it could be related to wellness, it could be related to recovery and response, any of those expenses, infrastructure, so looking at administrative type equipment. So just looking at what our needs are internally and then looking to our community partners to see, you know, what their needs are as well.
So you have a lot of flexibility.
There's some flexibility, but we still have to get approval if anything is over 5,000 from the grantors.
Okay.
Yes.
Any questions from Crystal about the grants that we have right now? 2024 grants?
Are there other grants that we'll be applying for as well, or?
It's a good question. Right now, I would say not at this time, you know, just making sure that we're spending down the current grants, but always, I mean, once these are over and if they don't extend them, you know, always looking towards grants, whether from Wisconsin DHS or another outside source, that will be part of the equation. But for now, I would say just
Yeah.
trying to spend
We're
this.
good. Yeah, great.
Yeah.
Any other discussion? Crystal, and this is brand new for you, I think, again, as well, isn't it? From 7 years ago, so things have changed a little bit, but I'm sure you're looking forward to working on this as time
Yes.
goes by.
Opportunity.
Feet in the fire already, I guess, okay. Okay, hearing no other questions, we're on to item number 8, Communicable Disease Report, Annual Overview from 2023 and Quarterly Review.
Yes, so Danielle has submitted this report, so I thank her for putting this together. And just like the memo said, just to highlight, 2023 was fairly typical. Of course, we had COVID, right? That's still being reported. But chlamydia is consistently our highest reported disease. So she did note some activity with active tuberculosis. Many people think that tuberculosis is a disease of the past, but it still rears, you know, its ugly head now and again. And so just managing that, the department has done a great job with that, and she's outlined that activity there. So sometimes someone doesn't have active tuberculosis, they have what's called an infection of tuberculosis, so latent TB. And so the health department's role in that is to provide direct observed therapy. And depending on the location of, you know, where TB was identified within the body, if it was in the lungs or extrapulmonary, we can do direct observed therapy monthly, sometimes it's daily. So it just depends on the case. But we did have a couple latent TB infection cases. So Danielle has been busy doing home visits, symptom checks, direct observed therapy, things like that. So COVID numbers, she wanted to note that they are not consistent from reporting with previous years just because people are doing more home tests, and maybe Debbie has already explained that. So a lot of it isn't being reported. What we do see is because our municipality participates in the wastewater sampling, we can see, you know, disease and illness activity through that. So we don't have direct reports coming, as many as we would typically see this time of year, but we do see wastewater numbers. So she has outlined this very nicely. Even the outbreak she put in, of course, we have 7 COVID outbreaks. Usually they are in the healthcare system. There's 2 that were in a non-healthcare entity, a norovirus outbreak, which again is very typical in any given year, and of course acute respiratory illness in healthcare.
What is defined as, how do you define an outbreak?
Yes, so 3 or more unrelated cases would be considered an outbreak. So typically when you're seeing upper respiratory infection, it really doesn't take much to be considered an outbreak just because it's so contagious. And so, so yes, in those healthcare institution, I mean, that is assisted living, nursing homes, you know, in our jurisdiction. Good question. Any other questions?
In terms of the municipal water testing, have you seen an increase? Has that been increase, decrease in the last quarter?
In the last quarter, I would say it was higher,
Okay.
and just monitoring, you know, it is going down, but it's elevated. And a lot of jurisdictions are seeing norovirus. So it's just something to watch. Again, very typical for this time of year. Yeah. So thank you to the city of De Pere for doing that.
I noticed that the latent tuberculosis isn't included on the infectious disease report. Is that because it's not infectious or?
Right, right. That's correct. There's still public health actions associated with it,
Okay.
but it is not considered, you know, an active case.
And again, your COVID cases are down because many people are home testing at this time and they don't report that they've got COVID then.
Correct.
So,
Correct.
okay.
Or not testing at all?
Or not testing.
We're not
That
testing
is-
at all, yes. Okay. Any other questions regarding the communicable disease report? Hearing none, thank you, Crystal, for that. And we'll go on to environmental health report.
Yes, so Trista put this together. Thank you to Trista for that. We did want to let you all know that the Common Council did approve the revised noise ordinance. And so Trista is working on, you know, just, of course, she was part of that. I believe they had a consultant come in and revise that ordinance. So she is, you know, becoming familiar with that, and she has the details there. She also outlines that I mean, she's just been busy with facility changes and ownership changes. So doing those inspections and re-inspection has taken a lot of her time in the last quarter. So she also has led a lot of the efforts along with other staff with Radon. January was Radon Awareness Month, and so the health department staff and Trista were doing education and outreach related to radon, the dangers of radon, and then giving out free test kits. So that was very popular, and she has the numbers listed in there. We are exploring the feasibility of creating a summer intern. One of the grants actually allows for local health departments to fund an internship program. So we are looking at that, especially the summer months when, you know, we have all the festivals and the events. It would just support Trista in her work. So we are working with human resources. Again, that would be paid for by one of the grants that we have on file. So she's been doing a great job. It's been great getting to know Trista and working with her.
Yeah, it looks like DATCP, which is the agency responsible for the food inspection program, is coming in March to
Yes.
evaluate
Yes.
the hotel and restaurant program here.
Right, right. And so that is, it happens, I'm not sure, on a regular basis, but I don't know every how many years.
It's been a couple of years since they were here last, if I recall.
Okay.
So
Okay. So I will be sure to have that report on the next May agenda.
Okay.
The results of that.
I also wanted to, if Krista was here, but you probably know the answer to this, but I was just curious about the being a proctor to be able to examine those coming up through and having a food protection manager. It was the first time I realized that you have to have a licensed a person with a card certified as a food protection manager at various for instance, school food programs. But there must be other larger facilities, probably like a nursing home or assisted living, any place that has food, I assume, so.
Right, right. Yeah, they have a Serve Safe certification
Yeah.
that they need to test for and pass. So their establishment needs to have that certificate
Yeah.
hanging. And so Trista is, you know, learning and developing herself to be a proctor for that test, which is great. It's a great service. So.
Now, this is a new term that I'm not familiar with. The food safety professionals, is that something restaurants have to be as well? Or is it just other
Restaurants.
type of,
Restaurants, yep.
is it a certain size restaurant?
Yes, yes, that's my understanding.
Okay,
It sounds like not everyone has to be, they have to have one on staff that's been
Right.
certified.
Right.
But not everybody, so everybody that works in a fast food restaurant doesn't have to be, but it sounds like
But the
it must be a
manager.
size related or,
It could be, I don't know the answer
Yeah,
to that, but I do know the kitchen manager is typically the one that holds that certification.
yeah.
How about grocery stores for their deli?
Mm-hmm, yep, serving food, right? And many grocery stores now, you know, they do so much.
Yeah.
It's, you know, their deli is truly a restaurant within itself. So, yes, very important to have.
Yeah.
well, we're pleased that Trista has become, I guess, environmental health sanitarian, and now authorized to become a proctor for that. So hopefully that will result in more local trainings than what we have right now. That's being conducted by other agencies, so that's great. Any other questions regarding that communicable disease report and environmental health report? Hearing none, we'll talk about the outreach and education activities.
Right, so it's my understanding that this was a standard agenda item on previous agendas. So I did want to keep with the status quo. You will see all of the trainings. January was a bit lower. And also, note too that the outreach and education, this is my perspective, so if you want to see something different, let me know. But I did not list all of our meetings as outreach and education. And so when I think of outreach and education, I think of, you know, the Vaccine for Children clinic, I think of the car seat clinic, you know, even the medication visits for latent TB infection, radon awareness, like that is prevention and education to me. When we're receiving the education in meetings or different things, I don't consider that outreach, but if you want, I will continue to revert and go back and list all of our meetings. But it was my perspective that prevention education is more outward. So that's why you see less in January. But I can revert back if it is your preference.
Like, can you look at in the November, December timeframe and identify areas in there that were listed there that wouldn't typically be listed
Right.
under what you're thinking?
So when you see under outreach and prevention, when you see CD surveillance group meeting or CD webinar with healthcare providers, that's more of our professional meetings and not outreach to the community. So that is just one example.
I guess the question I'd like to ask, is this something that you keep information on and use sometime in the future to justify the existence and how active public health is in De Pere? So is that something that you normally keep in another file somewhere, or?
Well, it definitely, since it's archived in our calendars, which is super helpful. If I ever needed to go back and pull that activity, we also have activity in what the city uses for time tracking called Encode. And so a lot of times the nurses and even myself will write, and Kelly, and Trista too, will write comments. So if something is coded as communicable disease, if it was a meeting we attended, you know, we'll put meeting in the note. So could we pull it sure. And I can revert to go back to putting it on the outreach and education. It was more an internal education rather than outward based.
I like that you identifying outreach as reaching out, and not internal things. But I'm wondering if we could list the internal things under the trainings and conferences
Sure.
area.
Sure.
That might be, because that might fit more in there.
Sure. So the meetings, have them listed up there.
Do you think that'd be okay?
Sure.
Yeah.
Yeah.
Is that okay with everybody else as well?
Yep.
Would that be too much work for you, Crystal, or is that just easy enough to do?
It's easy.
Okay, let's just keep it that and add that stuff to it,
Okay.
or maintain what we've got right now then.
Sure.
Okay.
Tell us if we ask too much of you.
Okay.
And if it's too rough to maintain, let us know. I
Yes.
guess we can discuss next time.
Okay. Sounds
Or
good.
6 months from now, whatever.
Okay.
Okay, next thing is, next WALHDAB meeting, it looks like, is on March 14th.
Right. And so, just a process question for you all. Last time Kelly was kind enough to email you all to invite you to that meeting. I'd be happy to take anyone with me if you'd like. We just need to know ahead of time so that we can RSVP because they do typically order lunch for that meeting. So we will send out the agenda for the next meeting prior to the RSVP deadline. If anyone is interested, I have room for
All of us.
4.
Right? Size of the car dictates numbers, I guess, right?
Right.
Okay.
All right.
I guess
I'll
I'd be
say that
interested in knowing what the
I've
agenda
gone
would be
quite a
on
few-
this.
I've gone to at least 3 of them, and
Okay.
they've been useful to see how what issues face, that other counties face, and how they deal with that. So, and there's been also they have an educational piece usually, from an expert in their field, and yeah, all of that has been very, very useful.
Yeah. Good.
I guess I base it on the agenda that we have in terms of who's coming, what the agenda item is, and,
Right.
and if also if I'm available that day or not. So
Right.
Right.
the biggest thing,
Fair.
if we can get the agenda out soon enough, I guess that's when I make my decision, you know?
Perfect.
Okay.
Thank you.
I think that's probably true with everybody else. All the other board members as well, is really, it's substantive as well, so. Item number 12, future agenda items. Anything?
I'm wondering, are you addressing anything related to LGBTQIA, anything in the community related to that?
Sure. Well, diversity, equity, and inclusion, those efforts, we are, looking at even our social media and, outreach, just making sure that it's sensitive and making sure it's inclusive. We are working on a maternal child health grant right now that focuses on social connectedness
Oh,
with particular attention to high-risk groups, but really for all, ages and people. And so we just always have that as a cross-cutting theme with everything that we do. So nothing directed, but just really taking that into perspective when we're doing outreach and education, making sure that we, are sensitive to
I
making.
just saw I haven't been to it yet, the Neville exhibit on the history of Pride in Wisconsin. And then also ADRC has a social connected group for people who LGBTQIA or they're supportive people who support them. So those are things as you're reaching out to people and making them aware of those things as well.
Right. Yeah.
So,
Yeah, that's good. That's good. Yes. So a cross-cutting theme for sure in all of our programming, education, and outreach.
Any other future agenda items?
Well, I do.
Crystal?
Yeah, I do understand that the next agenda will have policy and procedure review. And any new policies and procedures, that typically goes in May, is my understanding, so I'll be bringing that forward. And then standing orders, I'll be working with the new medical advisor to get those updated. And then our annual report. So it's my understanding that that's been a standard May agenda item, so I'll be sure that that's done by the time.
Well, your plate will be full then, won't it?
Yes. And then, of course, as we talked, the environmental health evaluation results.
Okay.
So,
Anything else on that item? If not, are we ready for adjournment? Can I have a motion to adjourn?
I'll make, oh, go ahead.
I'll motion to adjourn.
Terry?
I'll second.
Second, Pam? All in favor, say aye.
Aye.
Any opposed? Okay, motion passes. Board of Health is now adjourned.